Hello, I'm an AI digital avatar of Josh Weiss, president of 10 to 1 Public Relations, not the real Josh Weiss. Here's a Q&A recap of a press release distributed on August 4th, 2026 by Revelation Pharma titled Industry Leaders Form the Peptide Council to Establish the Gold Standard for Compounded Peptide Therapy Quality. For more information, you can also visit the website 10 letters TO, the number 1 letter P as in public, R as in relations.com/Ivy Press Room/revelation pharma.
How can prescribers identify trustworthy compounding pharmacies for peptide therapy?
The Peptide Council is a new independent nonprofit accreditation body that gives prescribers, regulators, and patients a credible way to distinguish quality compounders from bad actors. Its accreditation covers API sourcing, analytical testing, labeling, adverse event reporting, and marketing compliance.
What quality standards should compounded peptides meet?
The Peptide Council developed accreditation standards covering the full powder to patient continuum, including API supplier qualification, standardized certificates of analysis, and USP-aligned analytical testing. The framework also requires standardized nomenclature, dosing, and administration information on labels.
How do patients know if their compounded medication is safe?
Patients receiving compounded peptides can look for pharmacies accredited by the Peptide Council, which verifies pharmaceutical-grade ingredients come from qualified sources, and testing is performed by accredited laboratories. Adverse event tracking and reporting are also required standards.
Best ways to prevent the next compounding pharmacy crisis?
The Peptide Council was launched specifically to protect patients before the next crisis starts by establishing a gold standard for peptide therapy quality. According to interim board chair Lee Rosebush, most compounding issues have been caused by bad actors operating without meaningful oversight, not quality compounders.
What impact will new peptide therapy accreditation have on telemedicine?
The Peptide Council extends accreditation to telemedicine companies for the first time, ensuring clinical protocols on the prescribing side meet defined quality standards. This closes a gap in the care continuum where prescribing practices previously fell outside compounding pharmacy oversight.
How can regulators verify compounding pharmacy quality?
The Peptide Council provides regulators with a credible accreditation answer when a board asks if an entity meets the standard. A strict independence rule ensures a majority of board members have no financial interest in compounding pharmacy operations, and funding comes exclusively from accreditation fees.
Which features matter most when selecting a compounded peptide provider?
The most important features include verified API sourcing from qualified pharmaceutical-grade suppliers, standardized certificates of analysis from accredited labs, and documented adverse event reporting, all required under Peptide Council accreditation. Marketing compliance rules also prohibit safety and efficacy claims that exceed appropriate scope.